So while giving local anesthesia to my patients, I've noticed that sensory loss occurs before motor loss. Why does that happen?
Okay, the local anesthetic agents, they are basically of two classes, esters and amides. Their mechanism of action is to block the sodium influx to the voltage-gated sodium channels of the various nerves. And when they act, they obviously act differently on different nerves. And how, why is that? Actually, the sensory nerves are smaller fibers with less myelination, and they belong to the type A, gamma or delta, usually delta fibers. While the motor nerves, they are type A alpha fibers. They are thicker nerves with more myelination, so they become less sensitive to the local anesthesia. That's why we see that the sensory loss is prior, while the motor loss is a bit after that.
Yes, sir. And also, sir, I've noticed the secretions decrease as well.
Okay, yes, definitely. When we give the local anesthesia, it will penetrate to the surrounding tissue, and the parasympathetic and the sympathetic nerves, especially the parasympathetic nerves in the oral cavity, when we say, they will be paralyzed as well, and the secretions of the salivary glands or the lacrimal gland will be decreased as well. Yes.
Yes, sir. Also, sir, the bleeding increases as well.
Okay, yes. Look, all of the local anesthetic agents, they are cocaine derivatives, and the cocaine is the only one of all of them which is a vasoconstrictor. Remainders all, they are vasodilators, like benzocaine and procaine and all of them. So definitely, when we give local anesthesia, vasodilation will occur and bleeding will increase. And yet again, there is another cause, that when we paralyze the nerves, the locally the arteries which are traveling in that area, the smooth muscles in their walls will also be paralyzed, which will lead to pooling of blood in the vessels and giving a second thing which will increase the bleeding. And so for that, what we can do, we usually add 2% adrenaline or epinephrine in the solution, so that the bleeding may be suppressed.
Yes, sir. They are vasoconstriction.
Yes, that will
Thank you, sir.
vasoconstrict.
Thank
You're
you, sir.
welcome.